Great. Thank you for whoever did that. Okay. All right. Yes, so we are recording the meeting and we've got me in the spotlight. Thanks. Okay, so I just wanted to explain a few things. We've got a Q&A box if you want to ask a question. We will be monitoring that. You could, and Kitty will be asking questions when the speakers are ready to take questions. So please put your questions in that Q&A box. The chat should be disabled. Let's hope that that works okay. We have 3 terrific speakers, and we're going to start with Dane Menkin, and I'm going to let one of our co-leaders from Indivisible Naperville, Nancy Turner, sorry.
That's okay.
I'm still trying to sort this through. Indivisible Naperville introduce our first speaker, Dane Menkin.
Should I wait for the spotlight or just go?
Let's see.
There we go. Okay. Hi, everyone. Dane is a family nurse practitioner and the director of LGBTQ services at a large hospital system in Northeast Pennsylvania, where he provides LGBTQ specific clinical care with a focus on gender affirming care for children, adolescents, and adults. Dane's role allows for access to a healthcare system to focus on an LGBTQ competency curriculum implementation and workforce education. Dane is the recipient of the AANP Award for Excellence for Pennsylvania in 2019. He is a member of WPATH and served on the board of directors for the Jim Collins Foundation, as well as serving as a consultant for Transline. He has presented across the country to healthcare and social service providers, working with transgender and non-binary clients and patients in program building and healthcare settings. Dane?
Thank you so very much. I'm going to go ahead and share my screen and then move this thing out of the way. All right. I think we had said before everybody joined, I'm on the East Coast and we are having a lot of kind of wild storms. So hopefully it'll all work out, but maybe there may be some interruption. All right, let me see if I can get into presentation mode here. There we go. Okay. So I'm going to hop right into content. I tend to cover a lot of information, so I tend to speak kind of quickly. But the result of that is that there are less questions at the end. So feel free to flag me down if I need to stop or put thoughts into the Q&A and we can address them towards the end. So I'm going to talk about some language and terminology first. I think that that's somewhere that a lot of really well-intentioned people get stuck. So we'll do that. We'll look at current access to gender-affirming care. We're going to talk specifically about what gender-affirming care looks like, because I think there's a lot of misinformation out there about what this kind of care actually looks like. You know, it's sort of made into these, epic, mythical kind of places that are highly secretive, and it's just not. It's healthcare. Gender-affirming hormones, I'll give you a little bit of an insight into that, some changes from those hormones and the medications used, and then some non-medical care. And then I'm going to talk very quickly at the end about how to be an ally, since after this you will be an expert. So we'll start out with, I'm going to do sort of 4 slides that will compile into 1 slide at the end to do some language orientation for you. So gender identity, as we define it, is literally just who you feel like you are. It has nothing to do with who you're born as, who your mother thinks you are. It's just who you feel like you are. For simplicity, and there are many more, but for simplicity, we're going to go with these. So male and female, we all kind of understand those. Transgender breaks down into 2 categories. There are folks that are assigned male at birth, but identify as female. And then there are folks that are assigned female at birth, but identify as male. And then there's a category of folks that are non-binary, which is a term that I think confuses folks. I have a slide that'll break that down a little bit more for you. At the bottom are 2 words that I think contextually help people a lot. So transgender is somebody who is assigned something at birth, and that something does not persist with them through their whole life. It's sort of the opposite of cisgender. So cisgender is the usual, the majority. You are assigned female, for example, at birth, and at 2 you're a little girl, and at 5 you're a little girl, and at 10 you're a girl, and at 15 you're a teenage girl, and then at 20 you're a young woman, 30, 40, 50, and through your whole lifespan, that identity stays with you. And that's the opposite of transgender. So here's some words, we like the LGBTQIA, and there's lots of other letters that we could put, and I'm sure you've seen. So these are some of those letters. I don't need to spend time going over what a lesbian is, what a gay person is, what a bisexual person is, but I do want to talk about the word queer because I think it throws people off a little bit and is confusing. This is regarding sexual orientation. Please remember, sexual orientation is who you go to bed with. Gender identity is who you go to bed as, and that's how they're different. So when we talk about queer, the reason I think it confuses folks is because it's a gender identity and a sexual orientation. People use it to describe themselves when they are in a non-traditional relationship. So if you are a cisgender man, but you have a transgender partner, the world might think, or a transgender female partner will say, the world might look at the two of you and think, yeah, they're a straight couple. That's a man, that's a woman, straight couple. But he may not identify that way. He may identify as queer because something is different about his relationship, whether that's visible to the world or not. Queer is also a word that we use to define people who are just different. And it used to be a pejorative word. It's certainly one of those words that culturally has been reclaimed, of the last decade or so, and is certainly is used pretty proudly. You'll see that word within the LGBTQ community. So don't confuse the two things that I just told you about with biological sex, or you already heard me say sex assigned at birth. So people in this country, in our culture, in our system, there are two assignments at birth. I'm not talking about people who are born with differences of sexual development or intersex conditions. That's different. And while those folks may also identify as LGBT or Q, that is not necessarily within the confines of what I'm talking about with identity. So sex assigned at birth, currently people are assigned male at birth or they are assigned female at birth. Largely what determines your sex assigned at birth is what is in between your legs when you come into the world. It's often just that simple, and that's the end of the discussion. We certainly have the ability and technology to look more closely, but that's largely what we will base on sex assignment. So this is where good things go bad. When we start to talk about gender expression is a person's behaviors, mannerisms, appearance that are associated with gender. And here's how this plays out. The bottom two pictures, you all looked at those pictures for a millisecond, and your brain, without you even knowing you did it, looked at the person on the left and said, that's a guy, the person on the bottom right and said, that's a girl. And then your eyes moved up to the top two pictures because they're far more interesting. Your brain did that with the two people down at the bottom based on the way you were socialized and what you learned without even knowing you learned it. You were taught that men have strong jawlines and short hair and facial hair and sharper features and, wear crew collar shirts. You were socialized that women have longer hair, soft skin, soft features, wear spaghetti straps, wear lower cut shirts, have visible breast tissue. You were taught that. And you live your life based on those assumptions. We read people's gender really from sort of like the chest up instantly. So the top two pictures, I think, are good examples of somebody or people who are non-binary. They don't fit into the typical mold that is the binary male and female system that we have in place. That top left picture is one person. It's sort of a collage of pictures of them. And in those pictures, some of them have facial hair, some of them have visible breast tissue, some of them have female hair accessories, some of them have male haircuts, and there's a lot of fluidity to that person's presentation and their gender expression. Same is true for the top right picture. We can make some assumptions about those people's sex assigned at birth, names that they use, pronouns that they use, sexual orientation, but really we wouldn't know any of the answers to any of those things unless we're ready to ask. So here's how all of those things kind of come together. This is not my graphic, but it is well used and well known. This genderbread person, and it puts together all the things that I just talked about. So we think about gender identity as our higher thinking. This is what sort of separates our species, and exists as our brain. Our gender expression is the whole of us, right? Our behavior, mannerism, the way we present to the world. Our sex assigned at birth is largely based on what is between our legs anatomically, and our sexual orientation is just about who we're loving, who we are attracted to. All right, so we got some language and terminology down. I am going to give you some just real quick sort of pictures of people that you probably are familiar with. These are well-known transgender women in our country and our culture. You have undoubtedly heard of at least one, but probably more than one of these women. These are our male to female, our assigned male at birth, identify as female people. And these are some pretty well-known transgender men. These are people that were assigned female at birth, but identify as male, change their body to line up with their identity. Okay. All right. So let's talk about myth and fact a little bit. So this slide is going to talk to us about facts. I'm sorry, myths, sorry. And then the next slide will go over and talk about the facts behind these. So I'm going to read through them all, and then I'll go to the next slide. We can toggle back and forth if it makes sense to do it. So often you will hear people who pursue gender transition often change their mind. And we know that that's not true. I'll give you a statistic about it. And when we flip the slide, being transgender is a mental illness. It is not a mental illness. It is a diagnosis that is in the DSM, all of them up to the DSM-5. And that is largely so that we can provide healthcare for folks. You need a diagnosis, but you could certainly be transgender and not have that diagnosis of gender dysphoria and still be treated medically. Gender identity and sexual orientation are the same thing. Hopefully you were listening when I told you before that they are not the same thing, that gender identity is about who you go to bed as, and sexual orientation is who you go to bed with. Letting transgender people use the bathroom, locker room that matches their gender identity is dangerous. I'm not sure where that really comes from. I'm going to hand that to Naiymah to tackle a little bit later. Transgender people are confusing or tricking others. I don't think that this is true, but the next slide will explain where it probably comes from. Gender affirming care is expensive and a drain on our medical system. Not true at all. So here's sort of the facts and how you can rebuke some of these things when they pop up at your holiday dinner table. So we do know, we have statistics and we have studies now, thankfully, that rates of regret are very low. They're not none, and that's okay. In 2023, there was a study published in the Journal of American Medicine, the 235 people, so small, who underwent gender affirming chest surgery, and there was no one in that 235 sample that had regret or attempted to reverse. Being transgender is not a mental illness. Some transgender people have gender dysphoria, that diagnosis I talked about, which is treatable with medical and surgical intervention. We talked about sexual orientation, gender identity already. The conversation around bathroom safety and danger sadly goes right back to racism and Black women or Black men and white women and bathrooms. I'll leave that there. This is the opposite of what transgender people are doing. Trying to trick you is really not on the agenda. There are very few people that would go to this length to trick people. That itself is a mental illness. It's actually the opposite. People are saying out loud that this is who I am. In 2001, when we talk about drain and cost on healthcare systems, this is really interesting to me. There was a very small study done a very long time ago in San Francisco. I don't know if any of you even remember, but San Francisco was the first city government to cover all transgender and transition related care for anybody who was a city employee or their family. And that was super revolutionary at that time. So the city ended up spending $386,000 of the $5.6 million raised by the policy, because that's what they were anticipating, so low a cost that they dropped the additional charge altogether. So it's not a drain on anything. All right, so let's talk a little bit about disparities and kind of what these things look like. I'm not going to speak too long about this because Naiymah is going to cover it in much greater depth. But in case you really weren't aware, there are a lot of bills that have come up in the last few years in the last year, more specifically, that are anti-trans or anti-LGBT. You can see this exponential growth that has happened over the last couple of years. These are the states that currently have banned gender-affirming care, specific to youth, but it is a small leap to the next pond to ban gender-affirming care for non-youth in any of these places once the laws are in place. So what causes some of these things to happen for folks, and what's behind health disparities for LGBTQ people? Why is this important? Just a quick definition of health disparities. We know that there are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced more by socially disadvantaged people than not. So LGBTQ folks have higher rates of suicide, suicidal thoughts, mood disorders, anxiety, disordered eating, and then alcohol, tobacco, and substance use. Within the physical health realm, LGBT people are more likely to rate their own health as poor and report more chronic conditions. Lesbian and bisexual women have higher rates of breast cancer, and transgender men and women are at greater risk. LGBT people have higher rates of HPV, the virus that causes cervical, anal, and throat cancer. LGBT people are more likely to be obese, and still, believe it or not, in 2024, gay and bisexual men are more likely to be exposed to HIV, the virus that causes AIDS, than heterosexual men. So the thing that caused these disparities should not be, whoa, sorry, I went too far, should not really be any surprise to anybody. Really what we see is a lack of a minority status of LGBT people. There's a lack of specific education for training and healthcare workers. You would think, and I'm sorry to burst this bubble for you, but you would think that this is part of the curriculum in medical and residency programs or in nursing or advanced practice nursing programs, and I will tell you it is not. It may be a module, it's probably an elective for some people, but I will tell you the amount of time that these folks get in their education programs is minimal. I'm going to say less than 5 hours in their entire training. There's a lack of clinical research still on LGBTQ health-related issues. While that is certainly getting better, there is restrictive health benefits. We live in a country where if you work for an employer that says not covering it and not going to do it, they don't have to. They can write whatever they want into or out of their policy legally. There's limited role models. I put up a couple slides with some really famous transgender people, and you probably knew some of those people, but I will tell you that most transgender people's transitions don't look like those. There are very few people whose transition looks like what Caitlyn Jenner's looked like for lots of reasons. And still there is fear due to stigma, discrimination, and institutional bias in the healthcare system. So I'm going to talk a little bit about hormones and sort of medical intervention and what it actually looks like. This is a very busy slide. You're welcome to read it. I'm not going to read it through. But what I want you to know is when somebody comes to a provider for gender-affirming care, they've reached a place in their life where they feel like it is time for me to have some medical intervention. This is the criteria that they're being evaluated for. This is some pretty intense stuff. So they have to meet at least 2 of these, well, 6 of these, different lists it's 2, but 6 of these off of this list for at least 6 months. And largely what happens with this is there's a high bar to meet this, or it's a high bar to meet, both for the clinician who's interviewing the patient and the patient to sort of be not nervous enough and articulate enough and have enough introspection to go through laying out this very long and pretty personal history so that they meet the criteria for gender dysphoria to move forward with treatment. The establishment of this criteria is done by any qualified clinician. You don't have to be, there is no certification in this. There's no, if you're a pulmonologist or a gastroenterologist, you're board certified, you've done a fellowship. That's not what this is. There's no formalized program for this. WPATH is the World Professional Association for Transgender Health, has international and US-based criteria that are published and then peer reviewed. So this is sort of the Bible that is used in our country, a little bit also around the world. They're a little bit separate entities to tell people this is what we're looking for. These are the criteria that these folks need to meet to move forward. Please remember that hormones, and I'm going to go through them in a minute, are prescribed based on consent. There are a lot of things that people have access to medically that they don't have to give or get consent for specifically. So for example, if you want to make a very poor decision around plastic surgery on your face that you want to have because something's too big or something's too small, you can have that surgery. You don't need therapy letters. You don't need your parents' permission. You don't need, well, if you're a minor, you do, but you don't need permission. You just need to give your own consent and move forward. That is not the case with gender affirming care. It's the case with hormones that can be given permission by the person themselves, but to access surgery or access anything as a minor, you need consent from parent guardian, and then you need letters of support from one or two, depending on the procedure therapists. So hormones, this is a simplified slide, but these are the slides that I use when I teach clinicians. So when somebody is assigned male at birth, but their identity is female, the goal is to feminize them or to provide or provoke the development of female secondary sex characteristics. And we do that by giving estrogen. The estrogen that we're using in this setting is not birth control kind of estrogen. If a person takes birth control, they will develop some very small amount of changes to their body, but that's really not what we're going for. And these are the medicines. So estradiol is the drug. Lots of people take it as a tablet that they dissolve under their tongue. Lots of people take it as an injection that they give themselves subcutaneously, usually weekly. And there is estradiol as a patch that some people will use. And on the right side, those are just the doses that people tend to use, within a range. This is the list of things that happen when people take feminizing hormones. The things that are red do not reverse if they decide to stop taking hormones. So you can see these are rough time frames, of course, but up at the top, the 0 to 3, probably closer to 0 to 5 months. These are the things that happen to bodies in that time frame. We see a decrease in erections, a decreased libido. We see them, they will stop making sperm. There's softer skin, there is nipple sensitivity and breast budding, and slower hair growth. Once we get into the sort of 6 months to 2 years, we're talking about hair that thickens on their head. We're talking about changes to the penis and to the scrotum. We're talking about ongoing breast development and the bulk of breast development in this time frame. And we're talking about changes to emotional expression. So estrogen and testosterone don't ever make somebody someone that they're not. They don't make you a new person by personality. What they do really is they sort of increase the bandwidth of emotions, feminizing hormones that you feel from the world, and the bandwidth of emotions that you can express. You have access to different hormones or different feelings on feminizing hormones than you do on masculinizing hormones. Sort of that 2 to 5 year mark. So this is like your later kind of puberty stages. We get changes in body shape. We get fat will redistribute differently. We get hair growing on heads, usually longer, but often thicker. Estrogen does not regrow hair. And we see weight gain often in that 5 year mark, sort of that 5 to 10 year mark. Sometimes we'll see people put on weight. When we're talking about masculinizing hormones, we're only talking about one hormone is testosterone. These are the forms of it on the left, and then the doses on the right. So testosterone cypionate or enanthate are sort of those are very slightly different forms of testosterone that do the same thing. They are often as a subcutaneous injection. That I used to say there's no testosterone pill. There is a testosterone pill. We don't use it in this setting, but there is one that's commercially available. We use a lot of topical testosterone, the gel that people use commercially, the androgel and those things. There is a pen that is an injectable pen, like we all know about Wegovy, and we know about all these different pens that are out there. And there is a testosterone patch. These are the forms that we see people using testosterone. And just like with our feminizing medications, these are the things that we see from masculinizing hormones. At 0 to 3 months, we expect to see more hair. I expect to see a deeper voice. I expect to see an increase in libido and an increase in appetite. There are skin changes. And then we see that emotional expression shift, sort of the opposite of what I had said for folks that take feminizing medications. 3 months or probably closer to 6 months to 2 years, I expect people's periods to stop on testosterone. I expect new hair to start to form. I expect muscle mass to increase. And with regard to genitals, we see the clitoris is an erectile organ. It's what would have been the penis had the person been different chromosomally in the uterus. So on testosterone, it grows. Not tremendously, but it does grow. And then we see just some changes that are consistent with like vaginal atrophy on masculinizing hormones. Later on, that 5 year, 3 to 5 year range on masculinizing hormones, we see body shapes changing. We see terminal body hair developing. And if it's going to happen, we see hair loss, crown balding and receding hairlines. Just like with the other graph, the things in red here are permanent. They will not reverse if a person decides to stop taking hormones. Everything else would reverse if they decided to stop. So I want to very briefly, I'm not going into great detail about surgery, but I want to speak about surgery with minors because this gets a lot of people really fired up. And I have had a lot of people many people come up to me and say, hey, I need help in how to answer when, my great uncle Joe starts spouting off things that I know aren't true. But I need you to tell me what is the true so that I have something that I can say back to him besides you're wrong. So the first thing that I tell people to say is we don't do surgery on children as far as gender goes ever. The reason is this, it's actually very simple. There's nothing to change. There's no surgery needed on a body that hasn't gone through puberty, right? There's nothing to alter. So there's no chest surgery that needs to happen. There's no genital surgeries to happen when genitals are not even developed yet in puberty. So that's your number one platform to stand on. And you can really remember that. And please be sure that you let people know that. Genital surgery for people under 18 is wildly uncommon. I'm going to say it's less than 5%. And the only setting where I really see it in kids under 18 are kids that have really fully transitioned in every other way. They've been on hormones, they've had their name legally changed. They are fully masculinized or feminized. Their gender markers have been changed on their birth certificates or on their documents, other documents they have. So it's really, those are the kids that will be considered for genital surgery under the age of 18. Masculinizing chest and feminizing chest surgery is much more common, but masculinizing surgery in kids that are 16 and 17 is more common than breast augmentation surgery is for those ages. So what do we do with kids when surgery is not an option? Because there's lots of things that they need. For trans kids need support. So really what we do is we talk to them a lot about prosthetics and binders. We want to help them use things that help their body look the way that it feels best to them. So that means things like using breast forms and padded undergarments. It means things like using a chest binder if you are assigned female at birth and have breasts and you're looking for sort of a compression top to minimize that chest tissue. I always really encourage parents of minors for which it's appropriate to change their name. If you can't change it or are not going to change it yet legally, change it in the school roster in every place that the school will legally allow you to change it. They're allowed to have their non-legal name on their school ID, even if their legal name is not changed in the school district. Change their clothing, let them dress the way they want to dress, and understand that that will shift for them. There will be days where they are more masculine and more feminine. They're kids, and just like every other kid, they're trying things on. They're trying things out. They're seeing what fits, what feels right. Let them cut or grow their hair. And give them space for their mannerisms. Let them try on different things that they want to try on with regard to how they put their body out there and how they show you who they are. So now that you know all of these things and you're an expert, the most important things that you can do is be a visible ally. Just the fact that you're here, I know you're a visible ally. So take the time to understand that it's really important to use the name or pronoun that a youth asks you to use. It's okay to have your doubts about whether or not that will persist for them. yeah, I think this is really just a phase for, this kid. That's fine for you to think, but it's important that they feel your support and that you get the name and the pronouns right. Create a safe environment when you're around trans and non-binary people. You using the right name and pronoun for somebody when they're not there is very important. A lot of times, and I think this happens with parents, they will use they will use a child's preferred name when that child is around, but when that child isn't, they'll go back and use the other name. First of all, it's really hard for you because you're going to slip. We do things well when we do them repetitively. So let your brain have the practice all the time. But secondarily, if you really feel strongly that, you're not buying into this, that person's going to know. So make sure that you're creating those safe environments, both in your classroom. If you're a teacher, please. If you're a school nurse, please. If you're working in an office, at social gatherings. Make the place that you work more affirming. Take a look at the forms that your employer has. You would be shocked at how gendered policies and forms can be. We all know about bathrooms, and how frightening they can be for transgender people. So make bathrooms more accessible for trans people. Either, make all single stall bathrooms unisex so that anybody can be in there, because it doesn't matter because there's only one person in there at a time anyway, or find specific bathrooms in your location that are appropriate for transgender people to use. The bottom line in reality is we all want privacy in the bathroom. It doesn't matter who you are. So just find a way to make bathrooms private and safe for everybody. And then find your voice. I am not an activist necessarily. I don't do it very well. I talk a good game, but find your voice, whether that is literal voice and you are the person who's going to be out on the corner, with the megaphone yelling, or whether you're going to be the person who's in the background donating money and voting and helping to get other voters out. It all really matters. It all really counts. So find your voice. So these are some references, because often I do provide my slides for people, and I'm happy to do that if anybody would like them, but I am going to stop talking and stop sharing. All right. I don't know who's up next.
Okay.
Kitty's going to be
Yeah,
asking you some questions. Yeah.
Yeah. We had some, I think you've already answered Justin's question in the Q&A box, which was, will your slides be available after the meeting? So we took care of that one quickly. And Brianna too. I had a one question that I had is the right likes to misinform people that progressives are all for little children having surgical gender affirming care at the drop of a hat. And I'd like to feel more like I could describe a typical process and how careful it is, and how it takes time. Everybody gets time to think about it. If you could sort of lay out, as well as you can get to a typical process, I'd appreciate that.
Absolutely. So let me just repeat. So I think I understand, but I want to make sure. So you're looking for some information, and I'm thrilled that you're looking for it in this setting, because this is the place to find that information. How does someone access surgery, and how easy or hard is it to get surgery, gender specific? So what it really looks like is this. First, you have to decide what surgery you want, which might sound easy. I want a penis. I wasn't born with one. I want one. But there are a few different ways to do that, and some of them are a lot more invasive than others. So decide what you want. Second, find the surgeon that one might be covered by your insurance, but might not, and that you feel comfortable and confident with. There are not a lot of surgeons. There are a lot of surgeons in our country that do chest surgeries. There are, I'm going to say, about a dozen in the country that do genital surgeries. And for masculinizing genital surgeries, there's probably 5. So it's not like you just got to go to your major city and everything will be fine. These surgeries are not easy to find, and surgeons, the highly skilled ones are hard to find. I see Naiymah shaking her head. So those are the first 2 steps. Then you need letters of support from your therapist. If you're having chest surgery, you need one. If you're having genital surgery, you need two from two different mental health providers. No mental health provider sees you once and hands you a letter. So you have to go through the process with each separate therapist to get that letter. So after you've chosen your surgeon, chosen your surgery, it found out maybe it's covered, and then you have your letters, then you are allowed to schedule your consultation. So you call that surgeon's office and you say, I want a surgery. I want to schedule surgery for vaginoplasty. I was born with a penis. I would like a vagina. This is the surgery that you offer. And they say, that's fantastic. Today is January 9th. Surgeon Joe's next available consultation appointment is March 31st. Is that convenient for you? And you say, that's great. And 3 months actually is pretty good. So you schedule, March 31st rolls around, you have your consultation. You go in, they examine you, they go through, yes, you're a candidate. Next, you need to start to have laser hair removal and the procedures that go with moving hair out of the places that it can't be for whatever procedure you're going to be having. That takes about 6 months. So you undergo that process. And then after that, you follow back up with the surgeon. They say, great, you schedule for your surgeon, and this surgeon's next OR schedule availability is 6 months from now. And that's about right. And then you are able. So you can see the amount of time and work and steps that go into accessing these surgeries. Chest surgery is a little less onerous. You need one letter. There are more surgeons. It's more likely to be covered by insurance. But I went through all of that and didn't even talk to you about the recovery time. And how long are you going to need off of work, and who's going to be around to support you? And if you're an adult and you have obligations of your own, who's going to be around to help you with those obligations? Is your employer giving you time off for these surgeries? So it is no small feat to access surgery.
That's what I figured. What about hormone therapies?
Yeah, I mean, obviously, I think that's a lot easier to access. There are certainly more people in the country that are prepared and well trained to do that. There's still a shortage. I mean, I live in this I-95 corridor bubble of the country where, I can go anywhere from Boston to DC and get care. But that's not the truth for a lot of the country. So we see some interesting things popping up for hormone accessing, like we see a couple of membership services that are online hormone prescribers, and I don't speak badly of them, but it's not comprehensive care. These are folks that just prescribe hormones, and they do it well, and they do it as thoroughly as they can. But the process of that is typically finding somebody that you feel confident in. Hopefully your insurance covers the visit. Usually insurance will cover the hormones and the labs associated. Going in for the appointment, going through whatever process is in place at that particular place, and then continuing to go back, usually every 3 to 6 months for the first couple of years.
Okay. And what has to be added for minors?
For minors, you need parental or guardian consent, and in most states, you need both. So if you have a kid that has a supportive parent and a dissenting parent, no one's moving forward.
I see. All right. Well, thanks. That gives me a much better.
Good.
Also, we wanted to ask, these bathroom issues that seem to bedevil some people. What do you think is like the most effective thing that we could say to someone who has those worries and those concerns?
So you're talking you're talking in a setting where somebody is not wanting to make bathrooms unisex, or
yes.
Naiymah, are you going to talk about this when you talk tonight?
I can make a recommendation,
Go ahead.
but what I do when I lobby around restroom access is there's a lot of money that's funneled into being anti-inclusive of restrooms, right? And then also the chance of being sued for discrimination. So why don't we just invest in making single stalls, right, for everyone? Very, very much universal. We see this in the UK. I've seen this in a lot of organizations that allow folks, it's not open to the general public, but they have staff that are non-binary. And also, instead of creating a new restroom, let's just make them all single stalls, right? And that is comprehensive enough to deny someone over the perception, just using fear mongering as the concept of like trans women, or sometimes at some in one way or other putting cis women at harm. It's actually the opposite. So there is no data that supports that allowing trans women or allowing trans folks to utilize the restrooms that align with their gender identity puts any of the cis folks who use the restroom at harm. In retro, it puts the trans person at harm, right? Because with all of the rhetoric that's happening, folks just take their anger and their misunderstanding out and physically harm us. And when I say us as a trans woman who has visited states that have bans on restroom access, I'm telling you, I mean, I was tempted to use the restroom that was assigned for males, but I knew that there was a likelihood that I'll probably be assaulted by a male, right? And I also knew that if I used the restroom that aligned with my gender identity as a female, and someone knew why I was in their state or what organization I was attached to, or just me as an open, proud trans woman, that they could call the cops on me and say that I'm in the restroom that is not for me as a woman, as a trans woman, and then in that state that has outlawed it, or that county that has created a policy, now I'm a criminal for using a restroom. So a lot of the times, adding to our health disparities, bladder issues become prevalent in trans folks because we hold our urine or our bowels as long as we can, so we can get to a safer place to use it, right? So I incorporate all of that into the talking points of just create single stalls.
The Kitty, the one piece that I often that I think does come up is some facilities are, most places are building single stall bathrooms now, and that's fine. But a lot of people work in places where they're not. There's 4 stalls. It's it's a larger bathroom. One of the things that I have seen instituted that works well is if you put a lock on the inside of the main door. What happens is the person goes into the bathroom, locks the main door, they use the bathroom. Now, the trick is you have to be in there alone. If you go in there and there's someone else in there with you, you can't lock you and that person in the bathroom. But as a trans person, if they want to lock the door behind them so that no one else can come into that multiple stall door, there's safety there. So really the answers that I give employers are make all of the bathrooms that you can possibly make unisex, and any of them that you can't, make sure that there is signage somewhere that directs people that don't want to go into that bathroom to where there is a single stall bathroom, up a floor, down the hall, wherever it is.
Great, thanks. One more question has come up from Brianna. And I think this is about the legalities of what bathroom to use. What if you have not only physically transitioned, but also on all documentation as well?
I mean, that sort of comes down to the person that blows the whistle in the bathroom. I don't know what their argument is going to be, and I'm not even sure. It puts the authorities that come into that bathroom in that situation in a terrible position, right? What are they going to say? Drop your pants? And even if you drop your pants, if you've had surgery, like what are they going to say? So there's no definition for what makes a man and what makes a woman. There just isn't.
It's a social construct.
It's a social construct. You've
That's
absolutely got it.
All right, great. Unless anybody has other questions, real quick, I think we're gonna transition back to Candace and to the next speaker.
Thank you.
Okay, I actually
you,
do
Dane.
have a question for Dane. And I couldn't put it in the box because I'm the co-host apparently. So, but my question for you is a very personal one. I'm glad you're here. I have a niece who, born a niece, now a nephew, who is 12, and has been very adamant about the fact that he's a boy since he was very young. His mother and grandmother are taking the position that they totally support him, but they're not going to do anything until he's 18. So I guess my question is, how do I tell them that maybe they should consider the hormones, right?
I mean, hormones are not, that's sort of like a medical conversation. What I would encourage you to do is get them find them support groups so that they can hear other parents and other family members of transgender kids. There are a lot of them. Out in Illinois, why am I drawing a blank on the name? Is it Lion Martin? No, that's in Baltimore. It'll come back to me. Sorry, there's a name of a large Chase Brexton. No, that's in Baltimore too. There's a large LGBTQ center. If anybody knows it, put it in the chat because I'm drawing a blank on the name of it. But any of those resources, they need a support group so that they can start to hear others' narratives. It's not for you to convince them. The other Howard Brown, thank you. The other piece that that I would have you do is you as a person in that 12-year-old's life, you be affirming to them, and you sort of continue to advocate for them, and be that voice, because at some point that 12-year-old is going to start to develop some distress. Maybe they haven't yet, maybe he hasn't yet, but he's going to. And that's really when he's going to need a lot of support. What I sometimes tell parents when I do see them and they're not ready to move forward, I either hear that you got to be 18 thing, or I hear I'm just not ready to make this decision for you, because that's what they are doing, is I say, then don't. But the reality is none of us wants to live in a house with a depressed, miserable teenager. None of us. And that's where he'll head.
Yeah, and I think the support group is a great idea, and they're in Madison, so that should not be hard to find.
They're all virtual anyway, but yeah, absolutely get them connected.
Yeah, okay. Nancy has her hand up. Nancy Turner, do you want to go ahead and ask your question?
Thanks. Just my quick question, maybe this is going to be answered later, is if there are so few surgeons, why are these states, where they don't have surgeons? I mean, why are they banning all of this if there are so few places where people can actually get the care?
Why are they banning care if there's so little care available? Is that sort of the gist?
Yes.
I mean, because they're working within a political climate. They're not working. You're not seeing your medical organizations make those decisions. They know that we need more care. We need more all care, primary care and maternity care and, oncology care. We need more care available. The people that are making those decisions are political.
Okay.
Right.
Thank you.
Dane, thank you so much for that. Very informative, and we'd love to have you, if you could share your slides with us, we'll send it out to the people who registered because they were full of information. I found myself taking a couple of screenshots.
No
About
problem.
the slides. So
I'll email them off to you.
Okay, great. Thank you so much. Great. Next, I would like to introduce Naiymah Sanchez, who you just already heard from, but there we go. Great. There she is. I have her bio right here that I want to share with you because it's full of great information. I'm so happy she could be here tonight. She's a proud transgender woman who has contributed to reducing barriers experienced by the community and focused on increasing the quality of life that centers on individual needs. Ms. Sanchez wears many hats, from direct resource support to advocating for policy change. She uplifts the experience of those disproportionately impacted by inequity while overcoming personal challenges and exhibiting standards that co-empower her community to have agency over the work that creates the necessary change we need. Ms. Sanchez advocates for systemic equity. Systemic equity is working to move us forward through community education, relationship building, supporting inclusive policies, including just put in the stalls, guys, pushing for comprehensive laws, and most importantly, demanding accountability and oversight. She contributes her insight from the experience of her past and the impacts felt throughout the community while letting her passion for community liberation fuel her efforts. So happy to have you here, and you have many jewels on your heavenly crown. So,
Thank you. So am I waiting for a spotlight?
yeah, you're in the spotlight now.
Awesome. So thank you, Candace and members, for having me and the other speakers tonight. As mentioned, I will be discussing with you all for the next few minutes about the dark money and groups invested in blocking access for gender affirming care and denying trans folks the right to exist free from discrimination and harm. But before we jump into the organizations who have made it their priority of targeting trans and queer folks in America. Let's talk a little bit about what we as community members, community leaders are organizing against. So there have been over 200 pieces of anti-trans legislation introduced since 2020. And out of those horrible pieces of legislation, 75 bills actually passed last year. These bills include banning access to gender-affirming care, either by criminalizing the doctors or staff providing that care, going after parents who affirm their child's gender identity and pursuing affirming care, banning trans folks access to public restrooms that align with their gender identity, banning trans youth from participating in public school sports, and even going after our access to affirmative ID documents to ensure we had a hard time existing in our truth throughout society. Importantly to this meeting, 22 states have enacted laws or adopted some sort of policies banning gender-affirming care. These states are Montana, Idaho, Arizona, Utah, North and South Dakota, Nebraska, Oklahoma, Texas, Louisiana, Arkansas, Missouri, Idaho, Indiana, Kentucky, West Virginia, North Carolina, Alabama, Georgia, and Florida. With the exception of Arkansas, Alabama, Florida, and Indiana, because of legal interventions, folks who are seeking care are finding themselves taking extreme measures to get the care they need and desire. So the impacts for these horrible policies and laws range from seeking gray market suppliers of HRT, like Dane talked about, which is hormonal replacement therapy, estrogen, and testosterone, engaging in backroom body enhancing procedures like silicone injection and non-FDA approved filler substances, seeking refuge. Yes, and I said that right. In America, we have people seeking refuge in other states who are affirming, and in some cases, folks are engaging in self-harm as severe as death to escape the feeling of having no option left of support as a trans person in America. Now, when I do my trainings and I talk to large groups, I love to share the fact that, one, I'm a proud trans woman, but two, my journey from where I was yesterday to where I am today. So I transitioned preteen socially. In my home, it was something that because of the time, I'm 40 years old, and I'm proud to say I am 40, there was no language for trans folks. So I found it really hard to I want to say socially transition when my family just didn't have the language to support it. So I found myself leaving home and looking at outside sources to support me as who I was. I share a part of my story to also share that as someone who has been fighting for over 15 years for inclusive policies, for insurances, for just our mere right to exist in the world, the struggle that I had to get here included black market, gray market, gray market HRT. Like I used to buy my hormones from a community member. Sometimes the vials was open. Sometimes I just got a needle filled with a substance. I didn't know what I was getting. And I also engaged in silicone injection. And when I talk about my silicone injections, I talk about the impacts that it had on my life. Like when you get a needle with substance in it and you don't know where it came from, there's the chance of hepatitis transmission, HIV transmission, as well as with silicone injections, you don't know what you're getting. So when I talk about the impacts that these anti-trans legislations have, especially the ban on healthcare, have on our lives, it really puts us in a destitute of where do we receive care from next. So who is funding the attacks on trans folks in America? The reality that knowing where all the money is coming from might not be possible, but we do know for the almost 500 anti-LGBT legislation and policies that 5 organizations are funding conservative anti-trans groups. So here are the 5 prominent groups that I want you all to be aware of. The American Principle Project is one of the key groups coordinating legislation to restrict gender-affirming care while utilizing its political action committee to target Democrats with anti-trans campaign advertisements. Terry Schillings is the group's president, and he said that the group's ultimate goal is to ban gender-affirming care outright. And as Dane shared earlier, gender-affirming care is very broad. but they are very silo focused on surgeries, but never share that it's about banning surgeries. They just ultimately want to ban care and access to care, which we all have a right to. The 1776 Project, which is the next group, found in May of 2000, and I think it's 2021, sorry. Since it launched, the 1776 Project has said it focused on fighting critical race theory, a catch-all term as used by conservatives to tar and fearmonger to create efforts to teach public school students about white privilege, systematic racism, and America's history of racial violence and exclusion. Starting in September 2022, the PAC began to expand its attacks to gender-affirming care for minors, trans girls' access to girls' sports, and public school lessons about gender and sexuality. Moms for Liberty is a far-right education advocacy nonprofit who officially formed in January 1st of 2021 by one current and two former Florida school board members to organize, educate, and empower parents to defend their parental rights at all levels of government. In its early days of inception, the group rallied conservative parents to protest at school board meetings, first in Florida, before quickly forming local chapters in the country to combat COVID restrictions and also to talk about critical race theory. This group has since shifted its focus to opposing gender-affirming care, inclusive school policies that allow trans girls to play sports, and books on lessons on sexuality and gender, often using the term gender ideology. There's another group, Parents Defending Education, which came to prominence in early 2021 when the group, an education advocacy nonprofit that claims its mission was to fight indoctrination in the classrooms. They filed a federal civil rights complaint against school districts in Ohio, Missouri, North Carolina, Minnesota, alleging that they have violated federal law by acknowledging systemic racism within education systems. In addition to partnering with the group up top, Moms for Liberty, in their letter opposing Title IX changes, Parents Defending Education has used this platform to attack policies that support, in particularly, trans students. And the last group I want to talk about is the Independence Women's Forum. This is a conservative nonprofit that describes itself as a national women's organization dedicated to developing and advancing policies that are more than just like well-intended, but actually enhances people's freedom, opportunities, and well-being. The group, founded by conservative women during the Supreme Court Justice Clarence Thomas 91 confirmation hearing, has opposed progressive policies such as paid family leave and the Violence Against Women's Act. Recently, this group has highlighted and really plateaued on trans rights and working to promote legislation that would ban trans girls from participating in girls' sports, ban the access to women's restrooms, and end gender-affirming care for minors. Earlier last year, the Independent Women's Forum launched an online video series called Identity Crisis, which highlights the stories of so-called detransitioners. So we talked about these groups and we talked about the impacts and we talked about the legislation, but there is a slew. When I say a slew, it's an army of us out here. I'm one community advocate in Pennsylvania that work with many community leaders across the United States, and we don't take this sitting down. So I definitely implore each and every one of you to stay in contact with me, right? So you can scan my QR code for my link tree, or send me an email if there's any questions that you want to ask me that I can't answer tonight.
Yeah, can
Okay,
you put your email in the chat?
thanks so much. One question that I got prior to the meeting is for you is why now? Why are there so many anti-trans laws being proposed in the past year or two? It's just way more than there used to be.
I mean, there's many reasons. Again, I feel like, and this is me as a trans person who has watched the landscape change over the years. Since 2020, we've seen the escalation of it, but this wasn't the start of it. It's just that the base of the conservative has been riled up. And again, I shared this earlier about the fear mongering. There's a lot of fear mongering around harm, but there is no acknowledgement of the harm that trans folks experience by the fear mongering and a lack of understanding that this harm is causing people their lives. Last year alone, I mean, I think we had like 38 known murders of Black and brown trans folks throughout the United States. And a lot of these murders came at the hands of our loved ones, people in our community, but overall driven by the rhetoric that is pushing a lot of these anti-trans legislations. If you look at the legislation, and I do work for an organization, but I'm in my capacity as a private person. But if you look at the legislation that is being used in each state, they're all mimicking each other. The one thing that they do is they change the name, right? So the same legislation that we see in Florida, we've seen introduced in Idaho, we've seen introduced in Indiana, has been passed in Alabama. So these are mimic bills. They're not rooted in any facts at all. They're rooted in fear mongering. It's the desire. And I go back to one of the slides that one of the groups that I shared, the 1776 Project, right? Which came to its inception in 2021. So when you think about what happened in 1776, the Declaration of Independence, what was happening during the time when the Declaration of Independence was signed? There was a Revolutionary War. What was the war about? The war was about having enslavement of people, right? The opportunity to deny women the same rights, Black folks in America, equal rights. And because we have progressed in this movement of equality, and I'm using air quotes because we haven't gotten there yet, LGBT, especially trans people, is the lowest fruit on the tree. So if we can start chipping away at protections of those folks, then we can start galvanizing and taking the protections of all folks. I say this, is that they'll start with me and they'll end with you. Reproductive health care includes trans care. Like trans people have kids, have reproductive rights, right? And we see the two main issues that legislators and conservative lobbyists are focusing on right now is reproductive justice and access to trans care or LGBT rights. So it's really not, yes, we are seeing the escalation, but this was it was a shaken soda with a closed top. And now it exploded since 2020, right? The right feel like they lost control, and this is the way of them gaining the control back. It's just the base. But I will say this, and I speak this with my heart, is that even as a 40-year-old trans woman of color who exists in a world that have set up so many obstacles for me just to exist, I'm thriving. And I'm thriving because of the work of myself and other leaders, that the ancestors before me, and the work will continue, right? And we won't get liberation today, but we will unify this movement so we can have liberation for tomorrow.
That's great. What a great attitude. Thank you. Terry Watkins has had her hand up. Do you have a question for Naiymah, Terry? Can she unmute herself or?
Let me look and see if I can do that.
I can see that she's raised her hand, but I don't think I can unmute her.
I think I can unmute her if I
Okay.
can. Got to get down there. There. Allow to talk. Okay. Can you unmute yourself, Terry?
There she is. What was your question, Terry?
No,
We can hear you.
you can hear me?
Yeah, we can hear you now.
I actually did not mean to raise my hand, so I apologize for that. But I really do appreciate this session that you're having today. and particularly Naiymah's talking about her life and some of the things that go on for trans people. So thank you for doing all of this.
Thanks. Yes.
Great,
And
Terry.
that's it. Okay.
Yeah, and Naiymah, thank you so much. That was very helpful. And I think I got down all those 5 groups, so maybe I can include that in the notes.
I can also share with you the slides. But before you move on, Candace, there was a question by Brianna Surgot. I don't know if we got to that.
Let's see. Oh, no. She said it seems that there's more behind these groups being that they have been able to be so impactful in such a short time as in money and connections.
So I guess that was a statement. And I'm gonna share a little bit on why they have been so impactful. They're well organized. They have a goal. They say that LGBT people have an agenda, but our agenda is to live, to be able to live. And their agenda is to deny folks the right to exist free from discrimination. I will say that the disconnect between community organizers, not just in one state, but across the nation, has added to this because we're not using the same talking points. We're not using the same messaging. And this is something that needs to be uniform. They're uniform. They're well organized. I've been in Congress, I've been in my state building, and I hear them. Their language is well on point. They got everything. They're like this with it. And we're still trying to get organized. And I think that that's one thing that plays against us in this movement, but is for them, is that we're trying to still find our niche and we're fighting for money at the end of the day. They're well organized around protection for women is where they're going with this. But if you really cared about women, wouldn't you want to secure reproductive rights? If you really cared about children, wouldn't you want to make sure that your kids had affirming care and being able to go to a doctor that they feel comfortable talking to? I mean, I know personally, and I don't want to beat the drum too long, but I was in school as a young person and a trigger warning, sexual assault, but I had a teacher that touched me, inappropriately. And I wish at a time that at that time that I had a medical provider or an adult that I felt comfortable with that could hear this, right? Versus me feeling like I warranted it because I was a trans girl and I'm trying to get accepted in a school, right? So I do think that in one aspect, they are very well organized. They have their talking points and they have their base. And their base, I mean, it speaks for itself. Look who the front runner is of the 2024 presidential election for the Republican Party and what their agenda has always been, right? And I implore you all, even for myself and other organizers in community that I know that is on this call, on the Zoom, that we must unify as a community because the attacks are only going to increase. And we are in one of the pivotal moments of the election when we're coming up 2024 presidential election. And this is going to be a talking point. It was on the debate stage. And I see that it's going to be something that they use to win office. So we need to organize ourselves, uniform our talking points, and make sure that we continue to stay activated in this movement. So this session is very much in need to continue to happen.
Great, thanks. We're working on it. We promise we're working on it. All right, let me switch. And I am so pleased to introduce our next speaker, Aisha Davis. I'm sure we're related at some level, Aisha. Yeah. Aisha is an attorney by training. She's dedicated her legal career to civil and human rights advocacy and has worked in policy and advocacy both domestically and internationally. Currently, she's the senior policy counsel at ACLU of Illinois. She's currently focused on protecting civil rights in the state of Illinois, not an easy task. She calls Chicago home, but she was born and raised in around Washington, D.C. Growing up near the nation's capital inspired her passion for advocacy, and her family's influence sparked her desire to use her voice alongside her communities. She obtained her JD from Columbia Law School, an LLM from University of London in Human Rights, Conflict, and Justice. completing the degree program with a dissertation on intersectionality and international human rights. Boy, I'd like to read that one. Outside of her work in advocacy, she enjoys Black speculative fiction and most things nerdy. Welcome. Thank you so much. Take it
Thank
away.
you. Thanks for having me. Good evening, everybody. Like Candace said, my name is Aisha. My pronouns are she, her, and hers. And I'm going to share a little bit from the ACLU of Illinois' perspective, but first I'm going to zoom out to kind of lay a little bit of foundation, not only about what the ACLU is, but also what things are looking like nationwide, and then specifically in the state of Illinois. So first, the ACLU was founded in 1920. We are, 104 years old this year. And we're made up of a national office that is based in New York, and then 54 affiliate offices, including the ACLU of Illinois. Each of our offices has a legal, advocacy, and communications team that work together to secure the rights of all people. We are nonpartisan organizations, so we like to say that we have no permanent friends and no permanent enemies. Each of our offices uses a combination of litigation, legislation, and other policy work and communications efforts, which includes both education and issue spotting, to advance our work. So our national office in New York and all of our affiliates work together on the following issues: criminal justice and policing reform, racial justice, immigration, security, privacy, and surveillance, First Amendment issues, reproductive freedom, and LGBTQ+ rights. If you were taking notes on that list, you might have realized that some of those things come in conflict sometimes. And what that often means is that as an organization, we have to discuss what that means and how that looks for the work that we are doing. So as at every level of government, when we compare LGBTQ+ protections around the world, civil rights for queer and trans people does vary, right? So like the two other speakers mentioned, what you're looking at in the state of Illinois is not the same as what you're looking at in Texas or Florida or Tennessee or California or New York, right? We're all a little bit different. But then if you zoom out even further than looking at the United States as a country, when you look internationally, LGBTQ rights are kind of all over the map, right? So on one end of the spectrum, you have, let's say in March, a new law was passed in Uganda that serves to further alienate LGBTQ+ people in the East African nation. And that new law includes the possibility of the death penalty or life in prison for what is considered aggravated homosexuality, which includes consensual same-sex relations where one person is living with HIV. However, on the opposite end of the spectrum, you have Brazil, which recently made homophobic hate speech punishable by up to 5 years in prison, right? So the United States is not unique in having different states at different levels. There are different countries at different levels as well. So the landscape for queer and trans folks is a little bit spotty, which means that it's an extra level of labor that we have to do every day to figure out where it is that we're going, what we're doing, and where we would be safe. In addition to that, there are limitations on rights related to gender identity, especially when it comes to changing names and gender markers on identity documents like a license or a passport. And those laws vary just as much as the laws around same-sex relationships. And then there are some nations that permit self-identification on these kinds of documents. So like mentioned at the beginning of this conversation, when you're talking about someone who is going through a transition, they might have changed their documents, they might not have. In the United States, there are processes in each state that you have to follow to get those documents changed. But in some countries, you don't need a letter, you don't need any surgeries, you don't need anything like that. All you have to do is go into an office and say that I identify as a woman, and they will change your identity documentation. We may see that at some point in this country, hopefully, but we're not there yet. We have some growing to do as a nation. So to talk more specifically about what our work looks like as the ACLU, I'm going to talk a little bit about things based on a timeline. So Naiymah mentioned 2020 as a pivotal year, and that is absolutely correct. So in 2020, the Supreme Court decided Bostock versus Clayton County. And in that case, the court held that any person in any state who works at or applies for a job with an employer that has at least 15 employees is protected under federal law against employment discrimination based on sexual orientation and gender identity. What that means is that if a company employs 15 or more people, they cannot discriminate against somebody based on their gender identity. Subsequent to that, we saw decisions like Doe versus Snyder, which is the Ninth Circuit case that concluded that the Bostock reasoning requires that the federal law prohibiting sex discrimination by federally funded healthcare providers must be understood to prohibit unequal treatment of transgender patients. In Grimm versus Gloucester County School Board, the Fourth Circuit held that after Bostock, there's no question that adverse, unequal treatment of transgender students, including barring them from using restrooms corresponding to their gender identity, discriminates based on sex in violation of Title IX, and that's the federal law that prohibits sex discrimination by federally funded schools. So ultimately, what we saw after Bostock was a recognition in the courts that discriminating against LGBTQ+ people, especially trans people, was not permitted in schools and medical settings. Additionally, President Biden's executive order on preventing and combating discrimination on the basis of gender identity or sexual orientation further spoke to how the Biden administration's policy is that every person should be treated with respect and dignity and should be able to live without fear, no matter who they are or who they love. And then we saw a little bit of a shift in how things are looking with the Dobbs decision. I think everyone is familiar with it. If you don't know it specifically as the Dobbs decision, it is the case of the Supreme Court that reversed Roe versus Wade. We like to talk about this as like a pre-Dobbs and a post-Dobbs situation, and sometimes when we're thinking about the policy changes that have come up. But basically, the Dobbs decision has created a new set of potential threats to civil rights and liberties. I don't know if folks had a chance to read that the leaked opinion of Dobbs before the official opinion came out. But if you looked at, I believe, Justice Thomas's concurrence, he laid out basically a list of different rights that could be attacked after Roe was overturned. And among those, they included LGBTQ rights. So like Naiymah said, all of these rights are interconnected. Reproductive rights are not specific to cisgender people at all. And gender affirming care is not specific to trans folks. I just like to point out that anyone in this room has gone through menopause and taken any medication to help them through menopause, that is gender affirming care. So if you needed an example at the dinner table to say to your friends and family members, let them know that if they took any medication to help with hot flashes, you've received some gender affirming care. And I think that that's one of the things that helps to unify folks around these issues when we stop alienating people and we normalize the conversation that really it comes down to people being able to access the medical care that they need. So when thinking about LGBTQ issues from a policy standpoint, which is my lens for this work, outside of the personal lens that I have, because I do, as a queer person, have to deal with these things on my own. I also have friends and family members and loved ones who have to deal with these things. But from a strictly professional and policy lens, we have quite a few relevant issues going on today that are at the front of our minds in this work. First, we're looking at things like drag and freedom of expression. This is one of those situations where the First Amendment and LGBTQ rights kind of coalesce, and we try to think about the ways that we can kind of attack this from two different directions. There are 2 states in the country right now that explicitly restrict drag performances, and there's an additional state that has a law about adult performances that could be used to target or restrict drag performers. In addition to that, we have Don't Say Gay laws. There are 11 states that have Don't Say Gay laws, including Florida. And then there's a recent Supreme Court decision, which is 303 Creative LLC versus Elenis. And in that case, the Supreme Court held that a Colorado statute prohibiting public accommodations from discriminating on the basis of sexual orientation violated the First Amendment rights of a person who wanted to design wedding websites for different sex couples. So what we're seeing is a wave of policy that is attacking people's ability to just be themselves and express themselves. A lot of this is especially concerning because when you think about it, when you're trying to attack drag performers based on their appearance, it's not a quick shift or a quick jump to trying to decide whether a woman could wear pants or not, right? So we're talking about people trying to police the very expression of someone's identity. Like mentioned before, someone's gender expression doesn't have anything to do with their sexual orientation. I think a lot of times there's an assumption that if someone is wearing drag, that they must be a gay person. And while there are a lot of gay folks who do wear drag, that's not always the case. This also is one of those areas where people have conflated 2 issues, right? So I've had to have many conversations with folks to talk about the difference between someone being in drag versus someone wearing clothes that are affirming of their gender identity, right? So a trans person dressing in accordance with their gender identity and expression is not the same as someone who wears drag for a performance. And while there are folks who cross over in those communities, those are two separate conversations that we're having. But what we have seen is that when these policies are being put forward and passed, they're targeting all of those people across the board, right? So when you hear people saying things like, why should we let drag queens read books to kids in libraries, right? It's not just that they're thinking about the fact that there's someone who is in drag. They're also thinking about the fact that there are people who are wearing clothes that they don't think is appropriate for them based on their sex assigned at birth, like we talked about at the beginning of this conversation. And that level of policing does not really, it doesn't seem fair, I think, just on the surface level, but then when you think further about what rights that implicates, that also impacts someone's First Amendment right to freedom of expression. In addition to this, we've had a lot of conversations come up, and I'm so happy that Naiymah said this at the top of what she was saying. Trans folks are parents. Another issue that we've seen come up is around parental leave, and there are currently 12 states and the District of Columbia that have laws that grant leave to care for a partner, even if the couple is not in a legally recognized relationship, meaning that you don't have to be married and have a marriage license to have that kind of family leave. And there are 6 states that grant leave to care for partners, but only if a couple is in a legally recognized relationship. So that includes a marriage, it includes a civil union. But notably, there are no states in the South that provide this coverage. So when we're thinking about the ways that geography and where we are in this nation impact what's happening, you'll see that that's one of the issues that we see often, is that in the South, we have a lot of really strong anti-LGBTQ laws, especially a lot of strong anti-trans laws, but they also impact people who aren't in those communities. So having those bans on parental leave like that doesn't just impact us, like as queer and trans folks, that impacts people who, let's say you have had a live-in partner for however many years, you're in a straight relationship, your partner gets sick, because you're not married, and if you're not living in a common law state, you can't take leave to care for your partner. And a lot of these laws are specifically targeted to impact our community specifically, but we also know that there's a ripple effect in policy, how that happens. And so while some people may not be the intended target for the attacks, you might get caught in the crosshairs. And then I'm going to spend a little bit of time talking about gender affirming care and trans rights around healthcare, as well as like school and bathroom access, because all these things are tied together. So since 2021, 21 states have banned medically necessary surgery and medication for trans youth, and 1 state has banned the surgery only. In terms of school sports and bathrooms, since 2021, 23 states have banned trans students from playing sports according to their gender identity, and 11 states have laws that either forces or promotes the outing of trans youth in schools. Meaning, if a student goes up to a trusted adult in the school, it doesn't have to be a teacher, it could be an administrator, it could be a coach. They go up to that person and they express to this person, hey, you know, I don't think that my identity actually aligns with what I was assigned at birth. I want to talk about resources and options. I trust you. I might not be able to talk to my family at home because they're not affirming. In some states, 11 states, there are laws on the books that require that adult report that conversation to the parent, essentially outing a student to their parents, even if the home is not safe for them to be out. That's extremely concerning. We've already talked about this a little bit tonight, but just having that lack of affirmation in the home can lead to a lot of harm for trans young people. In addition, and kind of piggybacking on the earlier point around bathrooms and public accommodations, there are 7 states that ban trans people from using bathrooms and facilities consistent with their gender identity in kindergarten through 12th grade schools. There's 1 state that bans trans people from using bathrooms and facilities consistent with their gender identity in schools and some government-owned buildings, meaning you're a trans person going to get your license renewed. You might not be able to use the bathroom in that building. You're a trans person who's going into court to get a marriage license. You might not be able to use the bathroom in that building. If you're a trans person lobbying on an issue to talk about changing the policy, you might not be able to use that bathroom in that building without facing harassment or doing something that is considered illegal. There's also 1 state that bans trans people from using bathrooms and facilities consistent with their gender identity in all schools, colleges, and government-owned buildings and spaces. So when you think about how isolating that is, how harmful that is, we already heard about how that can impact young people. We also know that the longer that someone is kind of forced to told going to the bathroom, it impacts you in like over the years and can lead to some really terrible health outcomes. And then I'll touch slightly on another thing. One is that we have seen a lot of these conversations come up, and people trying to have these different ideas about where different states are landing and what states are considered good and which ones are not. I would like to move us away from that conversation because, as you've heard, all three of the speakers tonight are in different places. I'm here in Chicago. We have folks from the East Coast in the room. What we're noticing, because this wave of policy is basically a copy and paste of really terrible anti-LGBTQ laws, it means that people are being forced to move across different states, are being forced to leave their homes to get access to care, are forced to leave their home states just because they want to be able to go to the bathroom without fearing for their safety. What that means is that you have states like Illinois who have started to enact what we call shield laws. These shield laws are laws that protect access to trans healthcare. There are 11 states and the District of Columbia that have passed shield laws that protect this kind of healthcare access. And there are 3 states that have shield executive orders, meaning that their governors put an order in place to protect that care. Illinois is one of those 11 states. We have passed a comprehensive shield law that not only helps to keep gender affirming care safe, but also reproductive health care safe. That was the Patient and Provider Protection Act. The ACLU worked on that bill. It passed last year. It's a very strong bill, and I believe it's it might be the only one at the moment where it's both gender affirming care and reproductive health care in the same law. What we've noticed is that as Illinois is seated in the Midwest, and as you heard when Naiymah was naming the states, there are a lot of neighboring states that have laws that are directly oppositional to our laws. What that means is that spaces like Howard Brown Health, which was named earlier, are seeing an influx of people coming across state lines to get access to the care that's being denied to them in other states. That not only includes adults, that also includes young people. And I did want to just point out one thing about access to care for young people in Illinois. And this is to speak to the question earlier about like, what can someone do if they don't have affirming parents? In the state of Illinois, any person age 16 or older can get 8 90-minute sessions without parental or guardian consent, right? So if you want to go and talk to a therapist about your gender identity, about your gender expression, you have 8 90-minute sessions that you can get without your parents being told about anything. For a lot of people, that's enough to at least get them started on having these conversations to help decrease any stress, depression, anxiety that's related to not having someone to speak to. But it's just a way that Illinois has tried to create somewhat of an open door towards access to this kind of care. There are some limitations on different medical interventions, like was mentioned earlier. We are not allowed to allow minors to access hormone replacement therapy without parental consent. I think that it depends on the institution that you go to. So there are some places that do have more open policies around it where you can have one parent come in with a young person to get access to this care. But given the recent laws that have popped up across the country, when there are parents coming across state lines, there is this additional concern because there are states like Texas and Florida who have passed laws that will challenge parental custody if a parent helps a child access gender affirming care. In the state of Texas, they have deputized their version of the Department of Child and Family Services to actually take custody of children who are given access to gender affirming care. Recently, the state of Texas has tried to access documents from Seattle Children's Hospital where they want to know if that hospital has provided any kind of care for any children who reside in Texas. In Florida, you have a similar situation where if one parent decides to be supportive and affirming, the other parent can try to impact or essentially revoke their parental rights to their child. So what has happened is that we have these states where this conflict is coming up and people are trying to get access to care. And that puts Illinois in a very unique position to try to figure out how to continue to do what is considered lawful here versus what is considered unlawful somewhere else. And then the last thing I want to point out is that, because I believe we have mostly people from the state of Illinois on the call with us. If you are in Cook County, we recently passed a bodily autonomy ordinance that helps to extend protections around both gender identity and sexual orientation to prevent discrimination for employment and for housing as well. We also have what's called the Illinois Human Rights Act, which is a huge law across the state that helps protect access to what are considered public accommodations. So that's bathrooms, that also covers schools, which means that most schools in the state of Illinois, as long as they are not parochial schools or private schools, must have access to bathrooms that coincide with the child's gender identity. That in effect sometimes looks different. So for example, we have some schools that have created single-use bathrooms. We have some schools that have a lot more flexibility where the student body is more open and accepting, where students are just going to the multi-stall bathrooms. And then more recently, a piece of legislation called the Equitable Restrooms Act passed, which now allows businesses to have multi-stall gender-neutral facilities. However, that law is not a requirement, and that law does not extend into schools, hotels, or restaurants. So those are just private spaces where that's allowed. So in thinking about what this looks like in the state of Illinois, know that as Illinois, you are in a state that is kind of a beacon of what things could look like in a good way in the Midwest. And also there's still space and room to grow, because I would never say that there's any place in this country that is 100% safe for a particularly oppressed group like trans folks, like queer folks. But we do have a lot of really good policy on our sides and a lot of resources that we can always share with folks. I think I have pushed us over time, so I'm going to stop talking here, and I'll welcome any questions that folks have. And I'll also drop my email address in the chat. So please feel free to reach out to me if you have any questions.
Okay, there are a couple questions in the Q&A box. Brianna asks, as a proud Army veteran trans woman, how do I get more involved with helping advocacy for my community?
Oh, that's such a great question. Okay, so there are so many avenues that you can get involved in. One, the ACLU has a lot of options. If you wanted to become a member, we have different chapters across the state. There are also local organizations that specifically work on these issues or talk about them and help provide more advocacy-based work. I cannot list them all off the top of my head, but if you wanted to reach out to me, I can send you some more information about that. And definitely I'll look and reach out to some folks that I know to see if there are any veteran-specific groups that are doing this work.
Great, thank you. And Barbara's wondering why you're not specifying which states do have discriminatory laws.
That is because I knew I was going to run out of time. I can absolutely drop I could drop a link to a really great resource by the Movement Advancement Project that has a list of all of these different states and the issues that they cover. And they will give you each state specifically. And they also have really good reports that you can download and print out that also tell you what each law says. It gives you the law's number and everything like that if you wanted to do any kind of official citation. So I'm going to get that link and I will drop it in the chat right now.
Okay. I guess we have gone past 8:30, and we do have a few announcements to finish up with. So this has been fascinating, everybody. Thank you so much for all the great information. And
one question that I just want to touch on really quickly, Dane, about conversion therapy. So conversion therapy is illegal in the state of Illinois, and there are conversations around shifting that policy for religious exceptions because it's a First Amendment question. What I can say is that as it stands in Illinois, conversion therapy is still illegal. And if there are any questions around that or concerns, or if you've heard of anyone who's doing that and you want to report it or ask anybody for a connection to a lawyer to try to address that, please reach out to me and I'll do my best to connect you to somebody.
Great, thank you so much.
Okay, and yeah, Jackie, I saw your, I think I had another question for you or for any of the panelists about Abigail Schreier. She's gotten quite a lot of attention, claiming that young girls are being socially pressured into converting. And I just wondered if any of you have a comment about her and where she's coming from and who's behind her.
I don't know anything specifically about who is funding her or who might be behind her, but kind of echoing what Dane said earlier, the numbers don't lie about what it looks like when someone transitions, right? So are there people who have detransitioned? Yes. But is that number large? No. And then I also want to remind folks that when we talk about gender, and Dane mentioned this earlier, just talking about non-binary folks, gender is a spectrum and gender is also fluid. And so someone might transition and go from one end of a binary to another end of a binary. Somebody may transition and not move as much across that spectrum. Somebody might decide that they don't want to do any kind of medical transitioning and still will identify as trans. So when you're thinking about what gender looks like, just remember that it is a spectrum. There is no one way to be cisgender. There's no one way to be transgender. There's no one way to be non-binary. And what we're trying to do, and I think I can speak for the panelists, is try to make sure that laws are not restricting people's ability to explore what their gender is and how that gender is expressed. And that's really the end of it. It's not about indoctrinating anybody. It's not about forcing anyone else to do anything. It's truly just trying to make sure that individuals are able to make their own decisions. And that reminds me, just one other thing I'll mention. In Illinois, in 2019, we passed a policy that made sure that Illinois Medicaid covers gender affirming surgeries. And one of the things that we were very specific about making sure happened is that our law does not list out procedures that are covered. The law states that anything that a patient and a provider decide is medically necessary is medically necessary. There are some states where you cannot get like hair removal, like Dane was mentioning, covered by Medicaid because it's not considered medically necessary. And so what we're trying to do as advocates is push folks away from this idea about what gender must look like, what must be covered, and just rely on people to be able to make their own decisions as individuals. We wouldn't want anyone to tell us how we had to cut our hair or wear our clothes, or just speak in general. So why would we want to do that and impose those kinds of rules on trans folks?
Thank you guys so much. This has been so educational. And if you can give us your slides and any information you want us to pass on, I will send a follow-up email to everyone and give them that information because you've given us a lot to think about.
Thank you for having us. It was really a pleasure.
Thanks so much. We just have, I know we're running over and I apologize, but I think you'll all agree that it was very justified. We just had a few things. I don't know if Diane McGuire or if you guys want to make any announcements. We've got a couple of meetings coming up with Indivisible Evanston, Indivisible Illinois. We've got a meeting on progressive messaging in 2024 on Wednesday, January 24th. I'll include that in the follow-up. Linda, Diane, do you guys have anything you want to add?
Well, just introduce Indivisible Naperville to this wonderful group that's on the call tonight, and to compliment our speakers. It's been enlightening. It's been inspiring. I've learned so much, and I know every participant did. Indivisible Naperville's been around since 2017. We cut our teeth on the Women's March, and we've been going strong ever since. We do a lot of candidate forums for just all kinds of offices, municipal, park districts, school districts. We've done state's attorney, secretary of state, and the governor's races. We had an event on Saturday that got a little excited. It was the Defending Democracy event that we held at the Naperville Library, and we had a few activists there and protesters. It was quite lively. And we're going to be joining with Indivisible Evanston and others for the event with on messaging with Indivisible Illinois. Looking forward to that. Congressman Underwood, I think, will be date to be determined and the focus, but she's made herself available for us for perhaps in probably February or March. That'll be the next big event we held. We did have Speaker Welch in November. It was wonderful how easily accessible he was. He's the Illinois House Speaker. He came. We had probably close to 100 people that attended. That was a wonderful event, and lots of people got to meet the new speaker. And he was not as well known in Naperville, and now he is. So we're pleased. And Indivisible Evanston, I'm still in awe of what you do with swing states. Those postcards, we take them too, but not at your level. It's pretty darn amazing. So we're glad to be on the call tonight. Nancy and I are very grateful.
Well, thank you for joining us. We really appreciate it. Linda, do you have anything to add from the Indivisible Illinois?
Since we're doing the messaging meeting together, I don't need to go through that. I will just introduce who Indivisible Illinois is. It's a group that is kind of the umbrella of indivisible groups throughout the state of Illinois, and we work with, in conjunction to have informative meetings like this. We're a fairly new executive board for this group. The group has been around for 5-6 years, but we have a pretty new board, and so I am going to have Candace, when she sends out the email, include a form for anybody who's an Indivisible group or is interested in being part of Indivisible Illinois or one of the local groups to sign this form. And we're going to start reaching out to people to make sure that we've connected and we have the right list, because we have a kind of an old list, but that's it.
Great. Yeah, I think if you can, if Linda, if you guys can all send me the information, we'll send to everybody who registered or attended tonight. We'll send a follow-up with the slides and with the information we talked about, because I know we threw a lot at you. So thank you all so much for coming. Obviously, we need to continue these discussions and continue our education, but I think this is a fantastic start. So thanks to everyone for joining us tonight.
Thank you.